I think, it's always going back to what are we doing on a habitual basis for a lot of these things, Welcome back to another episode from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
And we are on episode 300 of this podcast. Oh my goodness, that is so crazy. So we're actually going to take this time to answer 3 listener questions about shoulder impingement diastasis recti and Meralgia Paresthetica. So we have some things to cover. We're going to try to make it super quick and catchy because we haven't necessarily dove into this on the podcast yet, so great questions. We're really excited. And we have a little giveaway happening. So stay tuned for that as well. So before we dive into these questions, I just want to understand what that giveaway was about real quick and talk about that really quickly. So actually, you have to go to a podcasting platform where you can listen to the Optimal Body audio podcast there, because if you leave a little rating and review, take a screenshot of it and send it and submit it to jen@docjenfit.com. That's our email, jen@docjenfit.com. Then you are entered into winning a $300 prize, which is free access into a year of Gen Health. Woo! So everything we talk about in order to get into our plans and feel something different in your body, we are so passionate about Gen Health and continue to make it just exactly what you need based on your feedback. So hopefully you get in on that little giveaway. We'll have a little bit more information down in the description below. And of course, if you haven't yet subscribed, please do here. Unfortunately, you can't leave a little rating and review on YouTube or else we would tell you to do that, but it is through an audio platform. We're going to cover shoulder impingement. We're going to talk about diastasis recti, and we are going to talk about Meralgia Paresthetica, which is probably something that other people are like, what? Unless you've been diagnosed with it, you probably haven't heard of it.
But a lot of people may have experienced this because sometimes if you're sitting for long periods of times, you can get this numbness on the outside of your thigh. That is what Meralgia Paresthetica is. It's kind of this numbness and tingling on the outside of the thigh. So we're going to talk about that, people who might be experiencing that, and some things you might be able to do.
So starting with shoulder impingement. Now, if you want to learn a little bit more about like the shoulder anatomy and what we kind of have talked about on another episode, is actually from episode 120. So that feels like so long ago now that we're on 300. But episode 120, we actually covered rotator cuff syndrome. And the reason that this is so correlated to shoulder impingement is because your rotator cuff has a lot of tendons that cross that joint. And those can get inflamed from getting impinged. Depending on the severity of the shape of that bone, you might need surgery. You might need a little bit of shaving of that bone. So it really is specific to what that looks like on your individual body. But in general, I would say that's not going to be as common, right? In general, it's going to be what can we work on the imbalances that happen around the shoulder that might be causing that pinching as I go to lift my arm up.
Being sure you can elevate and depress your shoulder blade. You can protract and retract, or kind of push forward and retract your shoulder blades back. You get good upward rotation, which we talk about a lot in that specific episode, and getting those arms overhead. I think it's when we talk about getting the arms overhead for something. I don't remember exactly. I don't remember what episodes we shoot. So becoming aware of what that shoulder blade's doing, practicing those movements more often, because then it will start to bleed into the automatic things we do every day, like lift our arms overhead, which is when a lot of people feel impingement.
100%.
When you go overhead or when you lift your arms out to the side.
Well, and I think we also have to pay attention to what's happening on the front of the body, because we are so forward dominant humans because we usually sit at computers or we're on technology. Like our environment ends up being very forward, which is why we kind of get those rounded shoulder positioning and maybe that a little bit of a closed off gap from that acromion to the head of the humerus. And so sometimes then we might not have as much freedom to move within that ball and socket joint. So what are we doing to address the front of the chest? Or how are we opening up those muscles in the front and kind of getting that rotation through the upper back and opening in that pec? Like I think before we go to jump to surgery or looking at how bad that impingement is, what are we doing on a day-to-day basis that we're really consciously working on that chest opening, working on those, releasing that restriction, getting that rib cage to move more. Our shoulder blade isn't going to glide well if our rib cage isn't expanding well. And so we need to work on breath. We need to work on pec release. We need to work on our shoulder blade control. If you can say that I have worked on all these things and it's still not getting better, well, then that's when we can maybe go and say, okay, is surgery going to be necessary?
Yeah.
And we do have a shoulder plan on Gen Health. It literally walks you through a 30-day plan of what to do on a day-to-day basis. Doesn't take you more than 10 to 15 minutes a day to do. And there's 2 separate phases that you can even start to progress into.
Yeah.
So if you need guidance, like, we have it for you.
Yeah, and go join that now because you get a week for free. So
Yeah.
you can get your free week, and then if you win, then you'll just get the rest of the year for free.
This is true. This is true.
Yeah. All right. So question 2, let's jump right in. Diastasis recti.
Yes.
And when people hear that, who knows what that even is? I think it's fairly common, or especially with women or
yeah.
people who have been pregnant, you probably know what this diastasis recti is.
But anyone can get diastasis
Yes, I have a
recti.
degree of diastasis recti.
And that is what's so important. So it's just that separation of, there's a tissue that runs between our rectus abdominis muscle called your linea alba. It is just this fascial connective tissue that kind of keeps our rectus abdominis together. However, our rectus abdominis is not the only muscle in our core canister. And so if we're overutilizing and over-tensioning this rectus abdominis, or putting pressure out forward, doing core exercises that your body hasn't quite patterned with the other core muscles, including our obliques, our transverse abdominis, our pelvic floor, our rib cage, our back, if all of those are not playing a role together and we're only really using that 6-pack muscle in the front, well, then we can start to get a little bit of increased tension that causes some separation of that tissue in the front.
So if we're putting so much pressure forward, which is what I did when I was a young athlete and had diastasis recti right on the front, so that tells me that I was putting so much of my pressure forward into this rectus abdominis area without supporting with the transverse abdominis that does have those fibers that pull laterally and can help support, right?
Women most commonly who have been pregnant have experienced some degree of diastasis recti. Listen, when you have, as I'm demonstrating here, a belly that is getting so stretched out on the front of your body, that linea alba has to stretch. It has to give, just like our other tissues, in order to support this belly that's growing and this uterus that's forming, right? So it is natural and normal to get a degree of separation. Now, how we work that back after we're in postpartum, it really plays a role in how functional we can be. There are people that I have seen who've gone back to CrossFit who can still fit 4 finger depth into that linea alba and have so much separation, however, still have a functional working core and functional working body. And sometimes when you get to that point, they just want surgery in order to kind of, aesthetically, yeah.
Yeah, not have that gap there.
But not because it's functionally not working anymore. Yeah. And I think that's what's really important to note. You can still bring the function back even if the tissue is super stretched out. And that's when it comes working with a pelvic floor physical therapist specifically as you're working on that journey back to movement is going to be so incredibly huge, so you understand how this all core pillar kind of works together. I see it get carried away in women a lot when we're trying to do these sexy core exercises we've seen on Instagram that your body's not quite ready for, or we're trying to progress into some core exercises that, again, we just don't have that control yet. We're not there, really. I mean, especially if you're thinking like toe to bar exercises or knee to chest when you're hanging especially, we need to start to rebuild that pattern. So if we're trying to overutilize our rectus abdominis in the front before we have control of our pelvic floor and our transverse abdominis, we're not going to have things working well together. And I will just say, this is where it's not meant for diastasis healing. However, if you want to prevent anything like this, the core plan that we have on Gen Health, which has helped a lot of people, it really walks you through that. So we start from the very foundational level of what is your diaphragm with your pelvic floor with that transverse abdominis. What does that mean? What does that feel like? And then how can we start to progress that over 30 days and different phases?
Yeah, and getting into planks and doing exercises on your back. It kind of takes you through every stage of developing that foundational understanding, and then how do you relate that into more functional type movements?
Yes.
All right, question 3, and this is one that people might not be as familiar with, Meralgia Paresthetica.
Yes.
right? Which Jen read, she's like, Meralgia Paresthetica. And this is one of those things like where for some reason when you go through school, random things get stored away in your brain. I'm just like, oh, that's when you get numbness on the outside of your thigh from entrapment of the lateral cutaneous femoral nerve and the inguinal ligament. And Jen's like, she looked it up. She's like, oh, yeah, that's exactly what it is. So no idea how that one stuck with me.
I think, it's always going back to what are we doing on a habitual basis for a lot of these things, When we talk about shoulder impingement, it's like, well, what environment are we setting up our body in and what are we doing continuously? When we're talking about this last one, what are we doing? Are we working on our hip mobility? Are we working on that core control? Are we working on all these areas? It's never just one thing. I think that's our forever message on our podcast, right? Is that there's no just one kind of fix, but really understanding and utilizing the exploration of your body and continuing to explore, continuing to get curious, continuing to move is always going to be most beneficial.
And really, that's why, for each of these answers, we've kind of referred back around to Gen Health, but that's why Jen and our team wanted to develop this platform to give you the license to explore, to put the power back in your hands, to start to do all these different things. There's a HIP plan on Gen Health as well that goes through 30 days, and that's just phase 1. There's multiple phases, but it goes through 30 days of different things that can help you explore this core stability and core pressures. It can help you explore all of the range of motions about the hip, different muscle activations that might help support that hip area. So again, you can go try it out right now. There's a free trial link down in the show notes that will get you that free week. And then also make sure you go leave a rating review on your favorite podcasting platform, snap a screenshot of that and send it to Jen at DocJenFit.com and you'll be entered to win a free year. So go start exploring the platform now, leave us a review, and we will announce the winner in a week. Thanks for joining us again for another podcast all about your questions. And please leave more questions below. We need to always have more topics to create these PT Pearl podcasts on. So did anything resonate with you? Did we answer one of your questions or do you still have one? Please comment below and remember, go to your favorite podcasting platform and leave a rating and review so you can be entered to win a free year of Gen Health. And of course, we'll see you next time.